So, hello, I'm Paula Melville-Clark, and I practice manage for my partner Barry Juillerat's Natural Health Clinic in Toowoomba, and I'm your host this evening on Redox Talks. Now, in a moment, I'll introduce you to Barry, and we're going to discuss the issues surrounding prostate health and how redox may well be one of the missing links in the treatment protocol. Now, if you're new to this call, you may be wondering what redox is. Well, very briefly, several years ago, scientists made a groundbreaking discovery. They identified molecules that are natively produced inside the body, and these help our cells repair and regenerate. Years of research and development went into stabilizing these molecules outside of the body so that they could be used as a cellular supplement to boost the often low levels that are produced naturally in the body. So the result is a molecular technology that basically helps our cells work better. And when every individual cell works better, our bodies work better. So it's a great pleasure to introduce Barry to the webinar. Barry has been a practitioner of alternative and preventative medicine for over 30 years. He's a fellow of the Australian Natural Therapies Association and holds specialist diplomas in naturopathy, homeopathy, Western herbal medicine, Ayurvedic medicine, nutritional medicine, and a heap of other things, including advanced deep tissue manipulation. Now, he's based in Toowoomba in Queensland, and he treats a wide range of acute and chronic health issues for men, women, and children, using his experience in a broad range of modalities. So, welcome, Barry. Today, we're going to talk about an issue, of course, that's common among older men and occurs when the prostate grows larger than normal. And Barry and I were chatting about this earlier. You know, men over 50 have a 50% chance of having an enlarged prostate, while men over 80 have a 90% chance of having the condition. And the medical journal, The Lancet, reported in 2012 that 210 million men worldwide, or about 6% of the male population, had prostate issues. So Barry, you've been in practice for over 30 years. How many people have you treated with this condition over that time?
Hundreds and hundreds. I couldn't even start to guess how many I've treated. And that would be people that have come primarily for prostate issues, but quite often it's in the last 5 minutes of a consultation about a sore big toe that they'll say, oh, by the way, I also have this other problem. Yeah.
So they tend to come in with another issue and then they turn it around to prostate. So there's a bit of a stigma attached to it. I guess the urinary tract isn't something a guy wants to talk about to his mates. Would that be right?
That's absolutely true. It's the last thing we talk about. Football, beer, meat pies, not your prostate, not normally.
So why do people get an enlarged prostate? What are some of the major factors and causes?
Well, there's quite a few, but I would think the ones that stick out the most would be milk consumption, would be high fat intake, chicken in particular, and eggs. They seem to be the ones that come up over and over and over again. And the other thing that would cause it is cold drinks. And I can talk about that a little bit later on.
So those are sort of food and lifestyle type of things. So would there be other things? I mean, the natural aging process, how does that impact on an enlarged prostate?
Yes, well, I mean, as men get older, their testosterone decreases and their estrogen increases, and that's where the problem comes with the prostate enlarging.
Right. So I guess symptoms vary from case to case, but they certainly worsen over time as the prostate gland continues to enlarge. So what are some of the early symptoms?
I suppose, I mean, everyone knows the usual one, which is the needing to find a toilet regularly, but also getting up frequently at night, feeling as if the bladder hasn't been emptied, can be burning. Also, even recurring bladder infections, and one more serious one would be blood, of course, in the in the semen, that would not be a good one.
So
But yeah, the frequency.
Right. Most men don't develop serious complications, but complications are possible, aren't they? So left untreated and addressed, what sort of complications might we see?
Well, that would be the blood in the semen. It would be bone pain, particularly in the pelvis. That's one you don't want to hear about. Can be back pain, lower lumbar pain, or sacral pain. That's another one you don't want to hear about either. So they would be the worst symptoms. They'd be the real red flags.
Right. All things that everyone would want to avoid, right? I mean, some people think of natural health practitioners as people who dish out nutritional and lifestyle advice, vitamin and herbal scripts, but that serious health issues tend to be the domain of medical doctors. But that's not really what we see in our clinic, is it? I mean, as a practice manager for you for 12 years, I know that you treat some seriously unwell people, often people who have tried everything in terms of drugs to address their health and are really desperate to turn their health around. So talking today about prostate issues and whether the cutting edge technology of Redox supplement can actually make a difference to the issue. But before we get there, can you tell us how, as a natural health practitioner, you have traditionally approached the treatment of this issue over the past 30 years? Presuming it's a benign issue, of course.
Yes. We're talking here about benign prostate problems. The herbal medicine has always been very good for that condition. I'm also a homeopath, so homeopathy is something that I would use, and I would combine both of those. I wouldn't just use one. And mineral therapy or trace mineral therapy would also be what I'd use. And diet would have always been a big part as well, but mostly herbs, homeopathy, most definitely.
So let's go to the last 3 years, because in addition to doing these things, you've introduced Redox health treatment to a number of patients in the clinic. I mean, not just with prostate issues, but across your clinical work. So how are you using Redox, and what results are you seeing when added to the more traditional natural solutions that you've mentioned to this particular condition?
Yes, well, using the traditional treatments, the improvement would be slow and steady. And so they would both observe changes, and there would be changes in their blood test, but it would be slow and steady improvement. But since introducing the Redox gel, and I'll describe how I use that, I get the client to put it on the genitals, on the groin, scrotum, penis, above the pubic bone, between the belly button and the pubic bone. And if they put that gel on there twice a day, 3 times a day, that the molecules will go directly to, or go to the prostate, basically. Internally, of course, the ASEA is probably the best systemic way to use Redox molecules. Now, since using that, the changes have been much quicker. There's a definite change between the way I traditionally use or treat prostate problems and what changes I'm seeing now. Is a definite increase in improvement.
I know one of the things that we talk about in our clinic, and it's possibly a problem all practitioners face, is that if the patient doesn't get results, and by this, they tend to want to see some improvements quite quickly, perhaps a few weeks, they simply go on to the next practitioner. However small, it's really about getting that result as quickly as possible, isn't it?
Oh, yes, most definitely. Like when I was using herbs and homeopathy by itself, it would be a slow, steady situation. So you always ran the risk of the person going, well, this isn't working, or it's not working quick enough because they wanted to be better yesterday. But combining it with using the Redox gel and the ASEA, because the results are so much quicker, you're safeguarding the possibility of the person stopping the treatment prematurely. And you've always got to tell the person, stick with it for at least 3 months. And then we can monitor it every week, every fortnight.
So adding Redox to the treatment protocol really does make a difference to the client, life changer, giving hope, and helps the patient stay in with the treatment so they don't throw the towel in and just go to the next practitioner and give them a couple of consultations and then go on to the next one. We're getting faster results. So Barry, moving on, a couple of case studies. Do you have some specific case studies you could share with us regarding a patient's progress, especially in terms of some verifiable results?
Yes, absolutely. There's two in particular that I can think of just recently, and both of them are a little bit different, but the results have been very, very good. One man who is on herbal treatment changed his diet dramatically to a whole food plant-based and has taken the ASEA internally. He has gone from a high PSA reading of 50 down to nothing. And that was the medical profession, or his physician could not believe it. He retested it, did it twice, and same result, from 50 down to 0. So now the second,
the prostate-specific antigens, they're the substances made by cells in the prostate gland, aren't they? But most men with a healthy prostate would have PSA levels under 4. Would that be right? Nanograms?
Yes, yeah, under 4, but as low as you can get it, the better. 4 is the cutoff. Yeah, 0 is ideal.
What sort of time frame were you seeing that client to get that kind of result?
That client got the results, I believe, over. They started their journey about 6 months ago, but I think it only took about 4 months to get those really, really good results. The second client, who did not change their diet as dramatically, but did go on quite a few supplements, and they were using the gel externally and taking the liquid internally. And they had a very good test, a very good result, not only for their PSA, but a whole across the board. Their bloods just changed from being quite, for their physician, his physicians, just being quite alarmed at his readings in lots of different aspects, to coming back with a clean slate, and they're just not understanding it at all. So he's had an exceptionally good result, and he sort of he said it actually has increased my libido. So that was he was very happy with that.
So people are always interested in the amount of Redox that people should take with specific conditions, whether they should drink it or apply it in the gel form. You've already addressed that. But when faced with prostate issues, what sort of amounts do you recommend?
Well, you can start with the standard dose, 60 ml twice a day. Unless there were some detoxification problems, you might start lower for a while and then build up to 60 twice a day. And then if you're getting good results, that's fine. But if you're not, then both these men were only on 60 ml twice a day. So very, very good results. But I would not hesitate at doubling and tripling those amounts, depending on what we're coming back with the PSA or their symptoms.
Wonderful, thank you. So you mentioned choosing healthy foods as being an important step towards recovery. So before we finish the interview, I'd just like to come back to the role of diet in the prevention and treatment of an enlarged prostate. Because there's a recent 4-year study in China that we've been looking at, Barry and I, looks at the effects of diet on prostate symptoms. And researchers found that men with diets high in fruit and vegetables tend not to have prostate issues, or if they do, they have fewer symptoms and are less likely to have them worsening. So researchers believe it's not just one nutrient that's doing this, but rather the combinations found in a healthy diet and lifestyle that are beneficial. So Barry, can you just speak into this, especially with reference to ASEA's Via Source? Because I know you are recommending this plant-based micronutrient supplement to many clients.
Yes, yeah. The introduction of the ASEA Source has taken people's health to another level very, very quickly. So definitely a whole food plant-based is very recommended for prostate issues and quite a few others, but it's very specific for prostate issues. And with that, then I did mention earlier about cold drinks. It's in Ayurvedic medicine, you would not be having cold drinks, ice drinks, cold beer. All those things affect the prostate badly. And of course, stress. So the less stressed you are, the more blood is getting to the prostate. So that's where the ASEA liquid comes in, because it changes stress levels, and the ASEA Source also changes the stress levels hugely.
Wonderful. Well, thank you very much, Barry, for sharing your clinical experiences. And we really hope this will give hope to people faced with prostate issues and encourage them to add Redox and Via Source to their treatment, and also to give their recovery the time it needs to see results. So just a disclaimer, of course, that ASEA products are not intended to diagnose, treat or cure any condition. They simply empower cellular communication and cellular function. So please get back to the person who invited you to watch this presentation, and they will let you know how you can get more information on Redox. Next week on Tuesday evening, our Redox talk will be hosted by Sally Diamond. She's going to be talking to Karen Murphy about her husband's cell dividing condition. So same time next week, please come along, invite people you care about who may be interested. So that's all from us, and thank you to everyone for joining us. We wish you a good evening.
Good night.